right. Well, I'd like to thank the moderators for inviting me, giving me an opportunity to share some of my experience with you. I also would like to thank them for choosing this topic. Being a reviewer is something that you will inevitably experience as an academician and a clinician, and this is a topic that I wish I had an opportunity to hear about before I made a bunch of mistakes as an assistant professor. So I will share some of that with you. This is my disclosure. It has nothing to do with my talk. I actually wish they would pay me to review papers, but they don't. So this is my agenda for you. I'll talk a little bit about the opportunity to review papers, the process, and a few pearls and a summary. So the opportunity, really again, when you think about it, this is an act of service. If you write papers, you should give back by reviewing papers. It's just part of the process. You're being part of the game. It's part of being a professional, and it's sort of paying it forward. It's also an honor. People who then ask you to review consider you an expert in an area, and so really consider it as that. Your colleagues many times have chosen you. Sometimes they don't tell you. A few of them do tell you that they put you up to be a reviewer for a journal because they think you have something to offer. It's also an opportunity to do career networking. Those of us who review, we talk about the process, what we go through, how we do it. It also is an opportunity for those. I mean, if you look at who are on the editorial board for journals, it's usually people who have paid their dues in the profession, usually chairs or someone ridiculously famous, and they know that you are contributing to the process. So just be knowledgeable about that. It's also your opportunity to ensure good science. This is our profession, and being a part of that process is, again, it's a privilege and an honor. This is sort of, for me, I think you need to have this on your conscience when you get that email and you have to decide whether you want to review or not, but really think about the big picture. It is important. The other part I'd like to say, just with respect to this, is that obviously we're all very busy. Whether you're in an academic medical center or in private practice, there's a plethora of paperwork within your career, whether it's your own papers, your own grants, your charts that you have from your clinic, or anything relating to clinical patient care, and then your reviews. So it's all part of the process. You need to manage it. And you need to be purposeful, and I'll give an example. One of the lessons I learned. Again, if you find that it's something that would be prolific or important to your career to be an editorial board member, you need to be thoughtful about it. You need to look at who is on the editorial board. Look at these people, talk to them, find out what the process is all about and whether this really will help your career. And it goes both ways. People will choose you, but you can also choose and ask. Those who don't get an opportunity, sometimes it's not because you're not good. It's just because you didn't put yourself out there and you didn't ask to be part of the process. The other thing which I found out after the fact, sort of your track record matters, and this is sort of a sneak preview of some of the articles that I reviewed for a journal. I looked at it and I was like, really, did I accept that many papers? But this particular journal is for a meeting, and so a lot of these papers are already vetted and reviewed and have. If you get the opportunity or the privilege to submit a paper, it's usually pretty good. And so the thing I want you to look at is the days taken. And that's pretty important. I do have 125 there that was a little late, a couple of days late. But most of the reviews, some of them will give you a week or a month depending on how it was, but most of them are within 2 weeks. And so when you get that email to ask to review, if you're a week before your vacation, say no. I mean, if you're trying to clear off your desk and you have a bunch of papers and everything, the reality is that you're not going to do a good job, and you can say no and you can refer. They always ask you if you don't have time to do it, if you're unavailable, is there someone else that you think you should do it? And just be thoughtful about that. Even it's better to do it up front as soon as you get the email, such that they have time to find someone else to review the paper. But this is really important, and there's some journals where the editors and the editorial board look at your track record, and they use this to decide whether you have the privilege to become part of their editorial board. So just be thoughtful about that. A little bit about the process. Again, there's nothing set in stone on how to do it. I can give you some examples on what I do. I used to do this. I don't do it anymore. I used to print the papers, and I'd read through every line and circle every spelling error and write all my questions on the side. What does this mean? Or this is awesome. And it was like I was a teacher, and I'd spend a lot of time doing this, and then I would go and type up my review. I don't do this anymore. This is what I do. I'm a Starbucks or Pete's Coffee, whatever. I'm a cafe person, any place I can find that's got a good drink and a place to sit. And I pretty much do my review on my computer. The left side of my screen is the paper. The right side of my screen is a Word document. And I cut and paste key things that I want to make a comment about. So this is really sort of the nuts and bolts of the process that I do. By the time I'm done with that Word document, I rarely have to add too much information at all before I then just paste it into the review. And so I've definitely gotten to be a lot more efficient at doing it. I kind of look at it, you're a food critic. I don't know, everybody knows, at least my friends in here know that I love food. And I can relate almost any process to a good meal. And for the most part, specifically when I get the paper, the first thing I do is I go to, like in a Word document, to like the 10% view, because then you can see everything on the paper. You can tell how many references, how many pages it is, how many pictures, and I sort of get a sense. That's just, my quick look, and then I go straight to the abstract. And to me, that's the appetizer. And you get a quick review of what it's all about. Is it something that's exciting? You could pretty make some good judgments by that. You know what the methods are, who the participants or the patients were, what the questions were, what they were after, and then what the results were in a short, well-written abstract. And that's the appetizer. And you get us, then that sort of sets you up. The next part I read is the methods. And the methods are the meat. That is the meat of the whole process. And the reason I say that is because if you don't get this right, the rest of the paper is kind of meaningless, and it sort of ends here for me. So when I'm reading through the methods, this is what I'm doing. If this is a randomized control trial, I want to know, who was the control, what was the treatment, how everything was divided. And I should be able to draw a diagram like this of sorts after I read the methods and understand whether the methods that you chose are really in alignment with what you set out to do. And if that's not the case, the review is pretty much done. You don't want to fall into this problem of garbage in, garbage out, because if your methods are wrong to make the conclusions that you're making in this paper, then that's the end. I can give a pretty good review at that point, because there's no way you can make the claims that you're making if your methods are wrong. So again, reading the abstract, I start with the abstract, then I go to the methods. It may end here, and I'm writing some notes and giving you some feedback. If I go on to that, I look in the results, and then again, if they're pretty complex, that's about the only thing I print sometimes, because you want to have the results next to you as you're reading through the paper, and it sort of streamlines things. And when I'm drawing my little flow diagram, I can tell what results match up to which group, and it kind of keeps it in order. And at that point, you can decide merit, because at this point, it's either ridiculously exciting research that's groundbreaking, or it makes a major contribution, or it's middle of the road, but it's important because it adds validity to other people who've done it and maybe took a different route, but the answer is still the same, and so you can say this person is adding to the validity of this topic that's new, and this is important to publish. And so at that point, you kind of get a sense. I think the introduction, I then read the introduction and the discussion, depending on how that is. And it really, those are the vegetables and the side dishes at the end of the meal. But really, again, the methods are most important for me, and that's sort of my process. A few pearls. I can share with you some rookie mistakes I've made and rookie mistakes I've heard about. So part of it I've already given you. I was doing book reviews. I was doing a long, drawn-out review, and some of you may know this person here. This is David Mavi. He's a hepatobiliary pancreas. He's a pancreas surgeon. Was one of my mentors at Northwestern. Still is, and I saw him once in the hospital, and he's like, "Yeah, what are you doing this weekend?" I'm like, "Oh, I'm reviewing a paper." And he looked at me, he's like, that's it? What do you mean? I'm like, yeah, I think I've got to read through the paper and then write my notes and do all. He's like, what are you doing? And that was his expression. He's like, what? You are not rewriting the paper. That's not your goal. You're not the editor. You're not editing this person's paper. You're being way too generous with your time. And now I know why you don't have life. So don't do that. And I took his advice. Here's the other part. I mean, sometimes you read a paper and it's awful. But I go back to what my mom always told me: if you don't have anything good to say, don't say anything at all. So I try to find something good to say. You know, the author should be commended for all of their hard work that they've done. Unfortunately, you know, and so it's sort of that lesson that you can go back and remember. You know, people put a lot of hard work into this, and you know, you try and encourage them. Some authors do really, really good but miss the mark on some things. Sometimes I give them a reference if it's a good paper or has some potential. I send them reference. I try to help, so I still spend a little more time, but most times, on average, I spend about an hour, sometimes 30 minutes. I mean, if the methods are just wrong, and I've gone through and I can figure that out and type it up pretty quickly. Some of the more detailed papers that are real, you know, randomized controlled trials, and it's actually a really good paper, I'll spend some extra time on it. Again, but recognizing the privilege. I did not recognize that up front, and I have a quick story about this one. David Mavi introduced me to someone. I was at a high-end muckety-muck dinner, and I'm being introduced to this person who will remain unnamed, and he says, oh, hi, yeah, you know, have you met Carla Pugh? And I said, and he says, and this is an editor of a big-time journal. He says, no, but she's, I know about her. She's pretty selective in her reviews, and I had turned down a review or two. And it's just amazing to know that these people actually really care about that. But so again, recognize the privilege, recognize that people are watching, and it's a big deal, and again, plan for it. So in summary, take advantage of the opportunity, balance it within your work life, things that you have to do, and be realistic about it, and find your way. Ask people how they do it. I just gave you an example of the way that I do it. There are a million other ways to do it. The goal is to be efficient and productive, avoid rookie mistakes, and have fun doing it. Thank you.